The levator labii superioris originates lateral to the eyeball and extends to the end of the nasal bone. The levator nasolabialis originates at the medial section of the nasal bone and extends laterally surrounding the nasal cavity. The levator labii superioris and the levator nasolabialis muscles are adaptations for rooting and assist in the movement of the snout.
The buccinator muscle forms the anterior part of the cheek. Its function is to keep the food in the correct position when chewing. The masseter, also known as the cheek, is by a strong tendon from the zygomatic arch. Its function is to elevate and move forward the mandible.
The medial pterygoid muscle comes from the pterygoid fossa and pterygoid process of the sphenoid. It is supplied by the mandibular nerve. Its function is to elevate the mandible for jaw closure and protrusion.
The orbicularis oculi muscle is located around the entire frame of the eyeball and is responsible for eyelid closure. The malaris muscle is located distal to the eyeball, which depresses the inferior eyelid. The levator anguli oculi medullis is located proximal to the eyeball. This muscle function is to lengthen and elevate the eyeball.
The rectus capitis lateralis is a short, flat muscle that connects the transverse process of the first cervical vertebrae, also known as the atlas, to the bottom of the jugular process of the occipital bone. Its job is to flex the alento-occipital junction, which enables flexion of the neck in the form of nadi. The omotransversarius is a longer muscle extending from the atlas to the distal end of the spinal portion of the scapula. It is innervated by the accessory nerve, and its function is to allow lateral movement of the head and neck. Another muscle located in the back is the longissimus. It is comprised of three parts, the thoracis, cervicis, and capitis. It has a multitude of insertion sites such as the thoracic transverse processes and lateral surfaces of the ribs, and its function is to flex the spine laterally.
The supraspinatus extends down the cranial aspect of the scapula and inserts at the dorsal aspect of the humerus. Its function is to extend the humerus. The semitendinosus is one of four muscles located at the plantar aspect of the thigh. These four muscles work collectively to extend the thigh and flex the leg.
The coccygeus muscle originates on the pelvic surface of the sacrosciatic ligament near the spine and inserts on the first four coccygeal vertebrae and fascia to move the tail from side to side and also to depress it. The levator ani is a broad, thin muscle that, along with the coccygeus muscle, completes the pelvic floor. It attaches to the inner surface of each side of the pelvis and plays a vital role in supporting the pelvic organs and preventing urinary incontinence.